So hello everyone, good afternoon and welcome to the National Hispanic Council on Aging webinar about mental health. I'm Christine Perez and the Director of Programs at the National Hispanic Council on Aging, or NHCOA for short, and it's my pleasure to moderate today's webinar. So today's webinar will be an opportunity to open a dialogue about mental health issues that are impacting Latinos and also provide an overview of the tools and resources that are available to them. Today, it's my pleasure to welcome a panel of experts that will provide an overview of mental health in the Latino community, a discussion about depression, tips for keeping your mental health strong and mental health resources available for Latinos, and a testimonial of someone caring for a loved one with memory loss. Before we get started, let's pause to thank our partners, including Biogen, Alzheimer's Association, and the National Alliance on Mental Illness, also known as NAMI or NAMI. So let's introduce our first speaker, Ms. Katie Sale. She is the Executive Director of the American Brain Coalition, also known as ABC, a nonprofit organization of the United States that is leading professional neurological, psychological, and psychiatric associations and patient organizations. The ABC seeks to advance the understanding of the functions of the brain and also to reduce the burden of brain disorders through education, public advocacy, and outreach. Today, Ms. Sell will be providing welcoming remarks. Welcome, Ms. Sell.
Thank you so much, Christine, for the introduction, and thank you for having me. As Christine said, ABC is a nonprofit umbrella organization, and we're comprised of over 150 of the United States' leading patient and voluntary health organizations, professional neurological, psychological, and psychiatric associations, publicly traded corporations that actively engage in brain-related research, and brain-related government agencies. ABC engages a broad spectrum of stakeholders to advance the care and treatment of brain disorders. Together, we seek to advance understanding of brain functions, as Christine said, and reduce the burden of brain disorders through public education, engagement, and advocacy with Congress, the executive branch, and the general public. Our members are families, patients, caregivers, professionals who are all fighting to cure diseases and disorders of the brain, and each bring their own unique perspective and life experience. I was thrilled when Christine invited me to participate in this important webinar addressing mental health issues impacting the Hispanic aging community. ABC is all too familiar with brain disease states from autism to epilepsy, from Parkinson's and MS to Alzheimer's, and the comorbidity of each with depression and mental illness. Researchers have shown a link between depression and dementia in older adults. People who are diagnosed with clinical depression, as well as those who experience elevated depressive symptoms, are more likely to show a faster cognitive decline as they age. As I know you are all aware, there is a great need for mental health services among older Hispanic adults. However, language and culture, along with lack of translators and scarcity of providers representative of the Latino community, are just some of the barriers that your community faces. Age and culturally appropriate services are really needed to overcome these barriers. While ABC focuses on all areas of the brain, we recognize and value our relationships with groups like the National Hispanic Council on Aging. We are always looking for the larger brain community like yourselves to advocate with us. Our legislative priorities have a broad focus, including supporting sustained funding increases for the National Institutes of Health, which includes the Brain Initiative, as well as the National Science Foundation and the VA. ABC favors public policies that support individuals with chronic conditions and expands access to chronic care. ABC supports the implementation of the Mental Health Parity and Addiction Equity Act and monitors legislation addressing parity in mental health and substance use disorders coverage. ABC recognizes the unmet need for the development of products to treat brain conditions. Private sector engagement in innovative neuroscience research has been in a decline over the past several decades. ABC has established a collaborative program to stimulate private investment in brain-related research and strengthen the entire research and development system for expedited translation of neuroscience research into life-changing therapies and cures. We encourage you to advocate with us as we advance these efforts. Advocacy can include signing on to ABC letters and statements in support of or opposition of legislative bills, endorsing other brain-related organizations' advocacy efforts, contacting your members of Congress about legislation that affects your community, and scheduling meetings with your congressional leaders to advance these efforts. I am now excited to hear from the panel of experts Christine and the NHCOA has brought together for us today. With that, I will turn it back over to Christine, and thank you for allowing me to join you.
Thank you, Katie. So, well, throughout the webinar, we will be presenting a few polls for everyone to respond to. So before we start with the panel session, we would like to present our first poll question. We will provide all of you a minute or so to complete it. So the first poll question is, what are good strategies to protect our mental health? So we have a few options, and you can choose, I believe, only one. But the first one is visiting a mental health counselor, doing things we enjoy, doing physical activities, and we also provided an option about other that you can type it in the chat box. So we will provide like 10 more seconds. Oh, we also have an attendee that mentioned all of the above. Okay. And of course, the highest was doing things we enjoy, followed by doing physical activities, and also visiting a mental health counselor. Perfect. So thanks to everyone who participated in the poll. So it's a fact that mental health conditions do not discriminate based on race, color, gender, or identity. Anyone can experience the challenges of mental illness regardless of their background. So let's welcome our next speaker, who is Josefina Mata. She is the Executive Director of Concilio CDS, a not-for-profit private organization in New Mexico with a program component statewide. So Mrs. Mata has experience working with underserved population and has focused on various national and transnational initiatives. So Ms. Mata has over 30 years of experience in administering healthcare and civic engagement, and also has been involved with cultural and art community programs in rural areas that have been federally designated as medically underserved populations and culturally diverse in New Mexico, West Texas, and in Mexico. So today, Ms. Mata will provide an overview of mental health in the Latino community. So welcome, Ms. Mata.
Well, thank you, Christine. Buenos dias, good morning, everyone. Thank you, Christine, again, and as well as that, I would like to thank our partners at NHCOA, Dr. Yanira Cruz and her team for providing this type of forums that are critical for voicing the challenges that our Hispanic Latino populations experience in their daily life. And so today, I will be discussing the mental health challenges that our Hispanic communities face and the repercussions and additional challenges that the COVID-19 pandemic has created within our communities. And that by building up individual resilience, we may seek to equip our communities to address mental health challenges in ways that fit the individual in unique needs. Next slide, please. Before the pandemic, our Hispanic communities were already facing historically known challenges in accessing mental health care and facing various health inequities. It would further affect the mental health wellness outcomes. These challenges were also known to be greater in rural communities, as access to reliable transportation, to access to mental health care may be at a greater distance, or due to community makeup, there are more older adults with mobility issues and children than working individuals that may be available to assist, transport, and support access to mental health care or other forms of health care. Additionally, addressing the cultural stigmas of receiving or even accepting mental health care is a challenge, as many do not want to appear mentally weak, crazy, loco or loca. And acculturation has also demonstrated a gap in access to mental health care, as US-born Hispanics may adopt an American perspective and accept mental health challenges, whereas foreign-born or Spanish-speaking dominant populations may perceive mental health challenges as individual vulnerabilities that are not meant to be disclosed publicly, much less addressed by a doctor. Next slide, please. And as with many challenges that our Hispanic communities face, mental health challenges may often manifest as a silent and deeply personal challenge that goes on without any support. And the pandemic created additional barriers in access to that type of care. Individuals may now face new chronic conditions or have family members to whom they provide care to have additional health challenges that creates additional stress, anxiety, and depression, making the management of mental health or self-care difficult to nearly impossible for individuals. Also, new changes such as the increased use of technology may make access to mental health care access a challenge, as most older adults or predominantly Spanish speakers have fallen behind in understanding the internet access process on smartphones, much less scanning QR codes to set up routine appointments for healthcare, even basic vaccination appointments. Consequently, searching for or obtaining a mental health care provider specifically, it's a foreign concept. Furthermore, studies have identified that Hispanic populations tend to focus on physical ailments rather than psychiatric symptoms during doctor's visits. As culturally, mental health is identified more as a personal individual weakness as opposed to an accepted health challenge that can be addressed by seeking medical care. Next slide, please. Some of the magnified barriers to mental health care access is the current caregiving crisis, in which families are overwhelmed with caring for their loved ones, that they often delay care to themselves and in their particular silent battles with mental health. And despite data or news that may demonstrate a strong economy and lower inflation, that does not change the reality that many families, in particular minority populations, went into greater debt due to inflation and job insecurity. And as for the whole of society has begun to open and move past the pandemic, pre-existing mental health challenges and the barriers to access care have not gone away. The gaps in mental health care have now become profound chasms due to the overwhelming accumulation of factors that our Hispanic communities live with on the daily basis just to survive that day and not really thrive. And so now many individuals face new unknowns and variables that will directly impact their mental health and quality of life. Studies have demonstrated a strong correlation of long COVID to the vast array of behavioral and cognitive health implications that individuals will face, and that the repercussions of COVID-19 on mental health in the long term is still to be forecasted, as the magnitude of negative implications is still to be seen, since Hispanic populations were already falling behind in access to mental health care pre-pandemic. Next slide, please. Building resilience within individuals for their mental health wellness may not be the solution to underlying problems, such as social, cultural stigmas, discrimination, or socioeconomic conditions. But it is the key to provide individuals with the ability to face their challenges with simple solutions that can be found through other resources, such as meeting the needs through community-based solutions, focusing on challenges of a whole family across generations, supporting climate change factors that affect healthy coping mechanisms. An example, rural communities may face extreme heat, which limits people's ability to take walks without being exposed to heat exhaustion. Then a solution be to create walking paths, parks with shaded areas, and access to water. This will help support healthy mental coping mechanisms in daily life. Furthermore, upskilling older adults and across generations in culturally competent information in tools such as mindfulness training or self-advocacy, which have been demonstrated to improve mental health outcomes across all age groups. Individuals then can be active participants in addressing mental health community challenges, and by providing various opportunities to address community needs, builds community resilience and sustainability of community solutions. Community challenges, including mental health, lies within the ability of our systems to support social connections across generations, because we know that everyone has something to give and we must try everything. Next slide, please. So again, thank you to our partners for this opportunity, for inviting me and to share this word, and to all attending as we come together to support our Hispanic populations so that we not only survive the daily challenges, but that we may all thrive and address mental health challenges. Muchas gracias y que tengan una bonita tarde. Thank you. Thanks, Christine.
Thank you, Josefina. And thank you for providing us an overview of the mental health among Latinos, and also, as you mentioned, the importance of community and having those resources regarding mental health. So in the community, so people can take advantage of and also receive the care that they need. So again, I want to remind all of our attendees that if you have any questions or comments for our presenters, please feel free to type them in the chat box, and we will address as many of your questions as possible during the question and answer session that we're having in a little bit. So before presenting the next panelist, we want to present our next poll. That is the following. What other mental health topics are of importance to you? So we have several options, and one of them is managing anxiety, knowing the signs and symptoms of bipolar disorder, suicide prevention, or other. And if you have other in mind, please feel free to type them in the chat box. So we are having like 30 seconds. I see some questions, some answers in the chat box. Okay, we say someone we have from the comments from the attendees, all of the above, recurring depression, depression in older adults. Okay, the first one was managing anxiety. That's most of you are interested in knowing more about it. And also suicide prevention, followed by others like alcohol and substance abuse as a coping mechanism. Perfect. Thank you all for letting us know your insights and also what other topics you would like for us to highlight. And again, thanks to all of you for participating in the poll. So depression is a common mental health condition that affects many people globally. Depression and other mental health conditions may be a problem in the Hispanic communities due to the stigmatization people may experience and also the difficulties in accessing treatments. Moreover, during the COVID-19 pandemic, the CDC conducted a survey where it found that adult Latinos are the group most affected by pandemic-related stress. That leads to depression as well. So let's welcome our next speaker, Dr. Dylan Saliu, neuropsychology head at Biogen, US Medical. Dr. Saliu has over 70 years of experience in the pharmaceutical and med device sectors, as well as clinical practice. Dr. Saliu has led global and US teams within medical affairs, clinical development, HEOR, and regulatory affairs focused on drug, device, and digital health launches. He has worked in both a psychiatric practice and also in primary care settings, directly managing patients, including prescribing medications, and also the digital health interventions in people with mood disorders, including MDD and also PPD. So today, Dr. Saliu will provide an overview about depression. Welcome, Dr. Saliu.
Thank you very much, Christine. And let me just make sure everybody can hear me. Perfect. So thank you very much for the nice introduction. And really thank you for the invitation today to open up a discussion around depression, which is a really important conversation for all communities, but especially today's focus will be in the Hispanic and the Latino communities. So first, I'd like to share a few facts with everyone and some statistics that Christine, you started alluding to. And that is there are 300 million people around the world that suffer from major depressive disorder. It's actually the leading cause of disability in the entire world. It's one of the top leading causes of disability, and something that is not only serious to the individual, serious to the community, but serious to society and the economy as a whole because of loss of productivity. The other numbers, that's 300 million. Now we take it to the United States, and when we look a little bit deeper, we find that 20 to 21 million people in the United States also suffer from depression. And when we move from the 300 to the 21 million in the United States, and now we move and really take a look at the Hispanic and the Latino communities, we find some really staggering statistics. And that is, I'll share a few right now with you guys. The rate of depression is similar, regardless of race, background, in terms of human suffering and what leads us to depression pathophysiologically, but access to care really causes a lot of discrepancies in what we see in the numbers. So I'll specifically share one statistic with you, that the rates of depression, specifically in the Hispanic community, are actually 39% lower than those of the Caucasian community. But when you look a little bit deeper, it's not because they're actually lower, it's because of the things that the other panelists have talked about, and that a major topic, which is the lack of access to care for multiple reasons. So when you actually look a little bit deeper, they've done a study where they looked at the prevalence of diagnosis of MDD in various ethnic backgrounds and races, and they looked at it based on availability of providers. And something really interesting we saw in this specific data. So this particular research was done looking at communities that had access to mental health care and those that did not. So for those that had more access to mental health care than a usual community, something really interesting happened. When you look at the white communities, they only diagnosed about 5% more patients, right? So those communities where there was more availability and access to mental health care. But when you look at the Hispanic communities in the same setting, meaning more access, more Spanish-speaking healthcare providers, you actually saw a staggering increase of about 20 to 25% increase in diagnosis, which essentially tells you that a lot of the community is actually not seeking care for multiple reasons and multiple variables. I do want to be able to also share a few other statistics. Even for those patients in the Hispanic or Latino communities that actually do end up seeking a level of care, some other interesting things happen when we look at the data. As compared to the white and Caucasian communities, which are about 60% rate of accepting pharmacotherapy or drug therapy appropriately, meaning when you really do need drug therapy, you see about 60% of the Caucasian community having that level of access to care, versus only 40% in the Hispanic or the Latino communities. And then it's higher. For example, the Black communities are 52%, white communities 60%, but only 40% of those folks that truly need drug therapy in the Hispanic and Latino community actually do end up getting it or deciding to go on it. Then when you look a little bit further down and you look at then what about counseling? And we see the similar trends, right? In terms of a mental health therapist, talk therapy, cognitive behavioral therapy, all effective models, we actually see less there as well. Then when you look at large studies that were done, population surveys, seeking to characterize and understand why is it in the Hispanic and Latino communities of all ages, including older adults, what are some of the reasons that we see that is really disrupting access to care for those with depression? And a few things that come to mind that have been characterized here are the cultural stigma being one of the top ones. And Josefina already talked about that. It's this concept of, you know, am I going to be seen in the community as crazy or loco? And I think that's a significant barrier that's been well documented. Other things like language, lack of access to providers that can actually empathize and understand the community, which leads to mistrust if they cannot. Misdiagnosis is another particularly big one. And I know, Josefina, you mentioned that earlier. A lot of times the Hispanic and Latino communities, when they go to the doctor, they may be complaining of things like nervousness or tiredness or physical ailments or body aches, which oftentimes can be related to depression. But because there's such an emphasis just on the physical component, you end up missing the opportunity for diagnosis and then for appropriate treatment, which is really a significant barrier to receiving care. And the other component is one that is important for all of us to work together on, and that is getting access to care once you have care available, meaning that in maintaining that access. The Blue Cross Blue Shield survey was conducted of well over 2,700 adults in various communities, including the Black and Hispanic communities. And what they found is specifically for the Hispanic and Latino population, 47% of the respondents actually did not end up going through with making an appointment for mental health for all the reasons that we discussed. And that was one of the highest from all the communities. And then there are other concepts of needing to be strong and really, you know, let me try to work this on my own, not airing dirty laundry in the public, right? And really keeping it more private. So there's just, these are some of the major significant issues that ultimately lead to a lot of damage and even suicide. And I want to share a really sobering fact, because this is, you know, this is something we all as a society have to work through, and COVID just made this a lot worse. But if you look at all suicides, out of the 30,000 suicides that occur in the United States, about roughly 18,000 of those suicides are due to depression. And then when you add when you add an already existing burden with staggering numbers that I just described, and then all of these barriers that basically stand in the way of good access to care, then we're left with a really dangerous situation for patients. And now I want to be able to move in a little bit more for the remainder of the time that I do have with you guys today. And well, what do we do about it? And you know, I've seen a lot of patients in my clinic when I was in clinic and when I was still practicing, including I would say about 20% of my panel was the Hispanic and Latino community members of all ages. And what I can say is that one of the #1 things that you can do today to take action, to advocate for other people, is to suspend judgment and to really watch and pay attention, whether it's yourself or someone else that might be struggling. I'm going to get into the symptoms of depression next, because just talking to someone and creating space, just checking in sometimes, checking in without offering even any advice, just checking in, asking somebody, are you okay? And opening up space for a dialogue can literally save somebody's life. So just checking in, if you notice something that's different about a loved one, a friend, or any observation, just paying attention. Sometimes all it takes for someone to open up is if you just approach that individual in a safe space, in a safe zone, and just say, hey, I'm worried about you. Is everything okay? Are you okay? That is very, very powerful. And I can tell you that approach literally saves many, many lives around the world when people do check in with others who may be struggling. So that leads me into what are the symptoms of depression, right? And a tool that I know Christine is going to share with the rest of all of you, and I encourage you to take it for yourself. And also, if you can share it with someone else, this could really also help. It is a screening tool. It's called the PHQ-9, or the Patient Health Questionnaire 9. There are 9 questions in it. That's why it's called the PHQ-9, that basically assess symptoms for depression. And then it's very easy to fill out. And then you get a score, and you can take that to your next healthcare provider appointment. It doesn't matter if that healthcare provider is a mental health expert or not. It really doesn't matter, because all healthcare providers know what a PHQ-9 is, and they can really be in a position to help. But let me talk a little bit about the symptom domain, right? So the PHQ-9 assesses a few things. This is what happens when we're depressed. Usually, it's a time factor. 2 weeks or more of the following symptoms. First, and the core symptoms is when you start to lose interest in things that you usually normally have a high interest in. When you start to feel low, down, and depressed. The other aspect is sleep. Either you're sleeping too much suddenly over this period of 2 weeks or more, or you're sleeping too little. It can go either direction. If you're feeling tired or your energy level's starting to go down from usual, again, sustained over 2 weeks or more. If you're starting to feel bad about yourself, having a lot of self-doubt, having a lot of voices in your mind, really feeling like, hey, I'm a failure. I feel like I'm letting myself or my family down. These are really critical components to pay attention to as well. Another big one is concentrating, right? Are you having trouble concentrating, or do you notice that a loved one around you is having trouble concentrating? Things like they're not able to really focus on watching a TV show, or reading a newspaper, or doing something they normally can focus on, but suddenly for 2 weeks or more, they're not able to really do that. Another thing is if people start to move slower, or start to speak slower, or the opposite of that is suddenly they start to be more fidgety. They seem more nervous, more restless. All of these aspects can be symptoms of depression. And then finally, of course, is if you're having feelings, even passive thoughts about hurting yourself, or feeling like, hey, I might be better off dead, or this is all too much for me. That's important too, because that's squarely related to symptoms of depression. So these are the 9 elements that are really important to assess. So for 2 weeks or more, if any of these things are happening, I would encourage everybody to take a PHQ-9, share the PHQ-9 with other folks, because it literally can save a life. And just opening up the conversation, right? This is really hard. And the Hispanic and Latino community is not the only community. It's many communities. All communities struggle with opening up a conversation on depression. I'll share a story with you guys from one of my patients in clinic. This individual had a family predisposition. They lost, he lost his sibling when they were younger to suicide, and no one talked about it. No one ever talked about it. It happened, but no one talked about it. It was just something that they could not talk about. They did not want to talk about. It was not normalized. It was stigmatized. It was just not a comfortable conversation to have. Whereas when they lost their father to cancer, everyone came, everyone expressed, everyone talked about how awful it is that someone passed away from cancer. But yet, when it came to suicide and when it came to mental health, we as a society are just not comfortable talking about that, and we should. We should, because that means we take care of each other, we're caring for each other, and it's no different than if someone has cancer or someone has high blood pressure. If someone walks into the office tomorrow and their blood pressure is 200 over 100, they'll be admitted likely and get an IV drug. to manage their blood pressure or some other medication intervention. But if we have the same outside of being acutely suicidal, if we have symptoms of depression, we as a society don't treat that with the same level of urgency, and it really ought to be treated with that level of urgency. So I would really say to you all, invite all of you to do just two things that can really help change the course of our society. That is, if you notice any of these symptoms, or even anything different about an individual, check in and just ask them how they're doing and open up that space. And second is share the PHQ-9. Share this free screening tool that's widely available that can be used, because if people take that and then they take that document and that score to their healthcare provider, that's how a good conversation can start about getting better and about getting the resources and the care that they deserve to have so that they can actually thrive. And then finally, for the last couple of minutes that I have here, I do want to talk about the treatment landscape broadly. I just want to talk about the science of depression. We're in a really, really interesting part of scientific advancements right now, because for the last 50 to 60 years, we've only really thought about the neurotransmitters. Let me explain what that is. You've all probably heard dopamine, you've all heard serotonin, and there are others like norepinephrine. So these are the neurotransmitters. These are the chemicals in our brain that have to be at a certain level and a concentration for our mood to be normal and for us not to feel depressed. For example, the current treatments for depression, at least from a medication perspective, they're really focused around increasing the concentration of one or a couple of those neurotransmitters, up and down, and trying to get that balance right. In the last 5 years, research is really going to a fascinating area broadly, and there are multiple companies looking at this, and academic centers and nonprofits, and that is this concept of GABA and glutamate. And I'm going to just share that with you for a minute. When we have depression, there are very specific areas in our brain that affect mood, including when we have depression, and they're regulated by these two large elements. One is GABA and one is glutamate. And what I want you to think about for this one is, it's kind of like the concept of a gas and a brake. So the gas is glutamate. It makes everything more excitable in your brain, and you need that, but you need it at a certain concentration. When the gas starts to get too much, you can actually end up having symptoms of depression and/or depression. So when that glutamate or that gas, you're pressing on the gas too much, your brain is firing too much, you can end up with mood issues, including depression. GABA regulates that, for example, and GABA is the brake. So when you activate GABA and you start pressing on the brake, you bring this excitability down and you actually balance this system so that you're back to what we call homeostasis medically, but it just means balance in your brain. And a lot of research is happening to understand these bigger mechanisms, not just the neurotransmitters, but the bigger mechanisms that are affecting mood in the brain. And what can we do not only with just medications, but also talk therapy and the combination of those things that we know work really, really well with patients. So really exciting science coming to the forefront over the next decade, I suspect, whether that is devices that are going to come on that are going to give us more information to be more resilient, take better care of our health, take better care of our brain health or mental health. We're going to have an explosion of new things coming to market that really are going to be helpful. The key, though, is you can have all these things, but if we as a society don't normalize the conversation, and this is where I want to end, if we are not going to make it comfortable to say, hey, being depressed or having a mental health disorder is no different than having cancer or heart disease or high blood pressure, we've got to get there for society, because we're going to save lives. And then finally, I invite you all, and I'm going to conclude with the same thing. It's the third time repeated. If you notice something different about somebody that you love and you care for, the best thing you can do is just check in with them, open up space, and just ask them if everything's okay. So with that, I'll pass it back over to Christine. Thank you for giving me the time. We're so passionate about making a difference here. So thank you.
Thank you so much, Dr. Saliu, for your presentation and also in providing an overview about depression in general, and also highlighting the importance of letting us know how powerful it is just to say and or just checking in with others, like how are you? Everything is okay. So thank you so much, Dr. Savi. Mental health includes emotional, psychological, and social well-being. It affects how we think, feel, act, make choices, and relate to others. Mental health is more than the absence of a mental illness. It is essential to your overall health and quality of life. It is important to note that the self-care can play a role in maintaining your mental health and help support your treatment and recovery if you have a mental illness. And let's hear more from our next speaker, that is Ms. Gigi Cautino, who is a longtime volunteer and supporter of the National Alliance of Mental Illness, also known as NAMI, in Georgia, and also a patient experience representative and interpreter for Northeast Georgia Health System. Ms. Cautino is intimately familiar with the barriers that the Latino community faces when dealing with mental illness. Ms. Cautino has a firm belief that we all need to talk about mental illness openly and be supportive of our members of our communities who are grappling with the immense challenges that come with this condition. So today, Ms. Cautino will speak about tips for keeping your mental health strong and also mental health resources that are available for Latinos. So welcome, Ms. Cautino.
Hi, good afternoon. Thank you so much. And so far, such interesting conversation and so compassionate. I am honored to be a part of this webinar. As Christine said, my name is Gigi Cautino, representing NAMI, the National Alliance on Mental Illness, and I'm going to talk about mental wellness. It is a pleasure to be here for this webinar. Next slide, please. So a little history about NAMI. The National Alliance on Mental Illness is a United States-based nonprofit organization founded in 1979 as a grassroots group by family members of people diagnosed with mental illness. Specifically, two mothers whose each one had a son diagnosed with schizophrenia. And in those days, there was not a lot of information, maybe not even a little bit of information out there for family members to learn, understand, and help their loved ones in this struggle. Also about the brain, about medications. So they started this group by getting information and figuring out a way to support each other little by little. This group has grown to be a national organization. We are in every state. There's affiliates in many, many counties and cities of every state. And we are dedicated to improving the quality of life of people with mental illness and their families through support, education, and advocacy. For more information on NAMI and all our programs, you can go to nami.org, where you will find vast information on mental health issues and resources at county, state, and national levels. Next slide, please. So first, we have to think about what is mental health. Like so far, we have been talking about what is mental health, and think about what does this mean to you? How do we define it? Next slide, please. So according to the World Health Organization, mental health is a state of mental well-being, which enables people to cope with life stressors, to realize their abilities, to learn well and work well, and contribute to their community. Next slide, please. What is mental illness? According to psychiatry.org, mental illnesses are health conditions involving changes in emotion, thinking, or behavior, or a combination of these. Mental illnesses can be associated with distress. They certainly are. And or problems functioning in social, work, or family activities. Next slide, please. So let's look at it this way. Mental health involves effective functioning in daily activities, resulting in productive activities such as work, school, caregiving, healthy relationships, ability to adapt to changes and cope with adversity. Mental illness refers to collectively all diagnosable mental disorders, health conditions involving significant changes in thinking, emotion, and/or behavior, distress and/or problems functioning in social work or family activities. Next slide, please. So what can we do to promote mental health and well-being? According to the National Institutes of Health, the mental health of older adults, since we are speaking about older adults, and in the Hispanic or NAMI community, the mental health can be improved through promoting active and healthy aging, creating a living environment that supports well-being. So how do we do that? Next slide. So how do we help create that environment? We start with the basics. You need safe housing. You need healthy, nutritious meals, regular visits with primary care doctor, taking medications for whatever conditions we have as prescribed, regular activity, a walk, going to the gym for those who can, swimming, moving, participating in health and social programs in the community. Communities typically have all sorts of social programs and health activities, health fairs, different things that people can participate in. Next slide, please. So here you see, we have folks going to the doctor, family getting together, different activities. So important to be out and connected. Next slide, please. So some tips in maintaining mental wellness. First of all, and so very important, is maintaining good sleep habits. So there is such a thing called sleep hygiene, and that's easily found on the internet for the details, but some of the things are not using electronics for the 2 hours before going to sleep. The lighting in your room, or just shutting down any electronics. The intake of caffeine, chocolate, things like that, too close to bedtime. Going to bed at the regular same time as much as possible. Getting up at the same time also helps. And those sort of things are very important. The temperature in the room is important, comfortable clothing, etc. Having a daily structure for meals and activities as well, you know, eating breakfast, lunch, dinner, whatever meals one is accustomed to at a regular time, and having periods of activity during the day. Then getting together with family and friends regularly. Being isolated is very detrimental and can cause a person to feel a lot of distress. Continuing to participate in community, cultural, and faith activities. You know, if you go to church, to the synagogue, temple, whatever the spiritual activity and a connection is for each person, it's important to continue that, to maintain that. Cultural activities, you know, we Hispanics are so bound by our culture and our customs, our food. And so those are things that enrich our lives and give us that sense of well-being. Then remembering enjoyable hobbies or finding new ones. Like if somebody likes to crochet, somebody likes to cook, somebody likes to, you know, paint, Some people love to make their tortillas, their tamales, homemade, baking. Some people have an animal, they take care of animals. There's so many hobbies and things that one can be involved in. It's important to continue to do those things. Listening to music, dancing, singing, expression, that is all, it lifts the spirit. Watching a funny movie with a loved one, or an interesting movie, a documentary, whatever you like. Volunteering in the community. If a person is able to, going out to help others, it gives a sense of satisfaction and contribution and of value that we are doing something that helps. So all these type of things promote a sense of well-being and belonging, which is so important. Next slide, please. So it is important to tell our loved ones, elderly or not, to always speak up if they are having any type of difficulty. You know, even if it's like Dr. Dillon was saying, you know, checking in, how are you feeling? You know, it's important also for them to know to speak up before something becomes a big deal, because it is harder then to manage it, handle it, and it'll take longer to get back to where wellness was. And so always, you know, encourage our elderly folks, especially, to talk about if they're having any kind of difficulty. It is always better, you know, to catch something when it's starting than to wait. In the next slide, there's a list of support groups for family members. Oh, but please stay in the other slide. I still need it. Okay. So there's a list of support groups for family members and caretakers of loved ones who live with a mental health condition. These support groups are a great way to not only learn to take care of others and to cope with the difficulties that come from taking care of somebody with a mental health condition. It also helps us to learn how to take care of ourselves. Because if we are not well, we will not be of very much use to another person. NAMI also has other programs like the Family to Family, the Familia a Familia, which I have taught for many years. And the reason why I trained to teach it was because it helped me so much. I was faced with a diagnosis for my son, schizoaffective disorder, and it was shocking. I was lost. I really didn't know anything about it. And so I went to their class, and it was like turning the light on in a dark room. Amazing, and the support. And I learned so much, and it made me such a much better and more effective caretaker. My son now is doing so much better and loving his life, and that makes me happy. So please go to NAMI.org, look at the information. If you have any a loved one or somebody close to you that might have symptoms of a mental illness or might have a diagnosis, NAMI has so much to offer. And remember that we are at county, state, and national levels. Now, in the next slide, you have those links to, these are support groups in Spanish for family members that are taking care of somebody that has a mental health condition. But these are also affiliates that have all the other programs, and they may be of help in so many different ways. The neat thing about having these resources of support groups in different states and places is that you may find one available at a time and day that's more convenient to you. And it may not be close, but since it's online, it's a Zoom type meeting, you can join anywhere. And I want to thank again NHCOA's invitation to participate in this webinar. Excellent information, and thank you so much. Oh, and here's also, I'm sorry, a list of resources. This is in English and Spanish. This is from a booklet from NAMI, Compartiendo Esperanza, Sharing Hope. That is also at NAMI.org. It's available there. It's a great little publication that helps open up the conversation about mental health conditions, especially in our Hispanic community.
Thank you, Ms. Coutinho, for your presentation and also providing us, an overview about the useful tips and resources that are available to keep our mental health strong. So thank you.
Thank you so much.
Absolutely. So I want to remind all of our attendees that if you have any questions for our presenters, please feel free to type them in the chat box. And before ending our panel session, let's welcome Margarita Navas, who is the National Hispanic Council on Aging Office Coordinator and also International Affairs Advisor. She will be providing her own testimonial about caring for a loved one with memory loss. So welcome, Margarita.
Thank you, Christine. Thank you for letting me share my experience as a caregiver. I became a caregiver of my mom. My mother, she was diagnosed with Alzheimer's, and she passed away a few years ago. But I want to share a little bit the way she was, because I think that didn't help me to think that she was behaving differently and maybe she had a problem. My mom was a very loving, independent lady and strong character, but also loved her family, but kind of bossy sometimes. And I am the only girl out of 5 children. She was kind of over possessive and, controlling sometimes. But she loved us, all of us, and she always was thinking on improving. When she moved to the United States, she was trying to open her business and things like that. I had 2 children, and when my mom she was diagnosed with Alzheimer's, my children were in elementary school, my son and daughter. And I am also housewife, making sure that the house was organized. Busy life like many of us. And also I'm an ESL teacher, and I was teaching English as a second language to adults at that time. When during that time, I saw that my mom's behavior was changing. And some of her friends, my mom lived like 5 minutes from my house. So I was her caregiver even when she was healthy, because she was not fluent in English. So I took her to the doctor or the hospital or to do shopping, supermarket. And back then I thought, no, this is my mom and, I'm going to help her. But I started seeing changes in her behavior. And some of her friends also told me that she was up all night, knocking on their doors. So, and my mom started calling me also at 3 a.m., panicking that she had lost money and things like that. So when I decided to take her to the doctor, I thought, okay, I'm not going to take her to the general doctor. I'm going to find out nice gerontologist. Like I said, she wasn't fluent in English, so I decided to find one in Spanish. Back then, during a few years ago, I couldn't find a Spanish-speaking gerontologist nearby, and there were a couple, but farther, and you know, I thought, okay. So I took her to English speaker doctor, and I decided, okay, I'm going to be one more time her interpreter. I'm going to explain the doctor what's going on in her behavior. And he listened, he looked at her. My mom was calm, quiet, and that was not her usual. She would like to be in the conversation, but she was very quiet at the doctor's office. And after he asked me questions, some I didn't understand why he asked me that, he said, your mom has Alzheimer's. But I said, I didn't want to accept that yet. And I said, are there any tests that she can take? Anything that, more studies? He said yes, but they are all in English. And also the administrators of the test are English speakers. So I said, I can be her interpreter. And he said, no. And I understand it was they were going to test her cognitive part of her brain. And so I had to face reality that my mom had Alzheimer's. I decided to take her home. Well, not I decided, but I took her home and became her caregiver. Along with that, and with my responsibilities, like as a mother, as a teacher, as a housewife, it was a big load of things that I had to think of and how to manage all that. And especially the way she was behaving, not sleeping at night, trying to open the door and things like that. But I said, when we love someone, when we care for our loved ones, we do it because we love them, we care for them, and we want to give them the best care, possible. So that was me also, trying to give her the best care. The only daughter here in the United States. I say, okay, I'm going to do it. During that time, she had an accident and she fell and she broke her hip. She didn't recuperate, so she had to stay in bed 24/7, not even in wheelchair. So they sent her to a nursing home, but at the nursing home, they had to rush her to the hospital for some kind of illnesses. So on the third time, I think, on the third week, I said, and my family told me, if you don't take her and you care for her, she's not going to last. So I decided to take her home and become her full-time caregiver. But I knew it was going to be challenging. I knew that, but I didn't know how much, because my mom was in bed all day, 24/7. So I had to be there all the time unless I find someone. And I had to move her one side to the other at night, every 4 hours, because she couldn't move, and she could have blisters. So that was my challenge. My challenge was I wasn't prepared for that. Meaning, not emotionally, but not only emotionally, but I didn't know how to change her bed sheets with her in bed. Things like nurses do, I didn't know how to do that. And when she came home, they just brought her. They brought her bed, hospital bed. They left her in bed, and that's it. They gave me a pamphlet to read, but I didn't have time. I thought, well, I don't have time to read all that. My kids were coming from school, and that was very hard. That part that I had to manage that time, a big amount of time, and with my kids in extracurricular activities and spending time in the house. So it was difficult and my mind was going very fast. How am I going to do it? If I'm going to be able to do it? With that, because of those responsibilities, the caring for her, and she didn't have any other problems health-wise, just that high blood pressure, so I continued with it, do that. But also her food had to be blended, so making different kind of little things that you know, a load of things that came. But like I said, I was doing it because I loved her, like many of us as a caregivers, that we take care of our loved ones is because we love them. But we forget about ourselves. And I forgot about myself. Like I said, some people, they say, you need to take care of yourself. No, I need to take care of my family and my mom in the house and some other thing, my students. So that was very difficult. That part was, during that time, I started feeling, you know, more isolated of everyone, because my kids went on vacation with their father or family, but I wasn't. And, you know, I didn't have that experience. Yes, they gave me telephone numbers, places where I could search for help. But some of those telephone numbers, they never answer, or if they did, never get back to me. So it was kind of, I was struggling. And I thought, if I'm going to spend all this time searching for places, I could be doing something else for my family. So I gave up, I guess, and I decided, you know, I'm going to stay with her. The nurse came, and someone came only once a week to help me. But it was, I was forgetting about me, taking care of myself. My sleep pattern changed because I had to get up early, every 4 hours at night. So now that I work for National Hispanic Council on Aging, and we talk with caregivers, is like, we need to take care of ourselves, because if we don't, we won't be able to care for others, for our loved ones. And we need to put that time to do something that we like. And the only thing I did was reading, because I love to read. So, and one thing is that I always found out now, that I know now, is navigate the system was very difficult, but also in trying to find help outside. But sometimes family or friends or neighbors want to help, but they don't know how or when. It's us as a caregivers is the one who need to ask for help. It's okay. It's not a weakness, is that it's necessary. And sometimes people want to help, but they don't know. They are waiting for us as a caregivers to tell them, can you help me? So for other caregivers, they are not alone, you know, and it's not wrong to ask someone for help, that I need this time, I need to stay by myself, I need to do this. And it's not like that you're becoming a bad caregiver or a bad mother or a bad teacher. And that's my experience. Thank you for letting me share that part of my life. Thank you, Christine.
Thank you, Margarita. Thank you again for your powerful testimonial. And as you mentioned, to other caregivers, you're not alone in the process, and it's okay to ask for help, right? So thank you, Margarita. So now let's begin with the question and answer session. Again, if some of our attendees have any questions, please feel free to type it in the chat box. So we have one question, and is the following, and it's open for all the panelists. And the first question is, how does the lack of cultural competence impact mental health diagnosis and treatments in Hispanic or Latinos? For the panelists, you can turn your cameras on and unmute yourself if you want to answer this this question. I will repeat it again. So how does the lack of cultural competence impact mental health diagnosis and treatment in Hispanic and Latinos?
So I can start a little bit with that. I think there's really the components that we all discussed, all of us really, that we hit on. What does it mean to be part of a community? All the wonderful things that are part of the community and the belief systems, and then how does that translate to potentially some healthcare gaps that may exist? So let me explain, and I can be very specific about one element that I had already spoken about, and that is, for instance, it's less of a, I see it, at least personally, less of a lack of cultural competence. I actually see quite a lot of cultural competence on the person side because you're part of the culture, but I do think that sometimes the providers can have a lack of cultural competence, and I'll be very open about that. I think if they're not fully aware of the intricacies of a particular community, their belief system, and how perhaps they may present, that could be a missed opportunity. So for depression, that means that, for instance, if I am not fully aware, educated on the nuance that a lot of the times folks from the Hispanic and Latino communities may present with a lot of physical symptoms, right, that I talked about, nervousness or total body aches, that may be non-specific physical ailments. If I'm not aware of that, then I may not probe into potentially, administering a PHQ-9, seeking further to understand, is this physical or psychological? That's one example that I'll share that could be a lack of cultural competence on the provider side, and why it's important for all of us to keep educating not only patient communities and communities, but also the healthcare providers so that they have full understanding of the different nuances of how patients may show up.
Yes, I agree, Dr. Salvio. And also, I think in the part of the cultural competence, it comes to the language barriers among the healthcare provider and the patient. We have a housing facility at Washington, D.C., and every day we see some of our seniors that are struggling in just talking more with their healthcare providers because their healthcare providers don't speak English and they need help in the part of interpreters, right? That are the ones that translate everything that says the healthcare provider to them in Spanish. And it's still difficult because when it comes to the healthcare provider providing like the instruction on how to use a certain medication, they are at the end when the senior comes to their home, they're like, okay, what do I do next? And sometimes the caregiver is there to help them, but also faces the same barriers as the patient in regards to the language.
Yes,
Yeah.
and adding to that, Christine, I strongly believe that cultural competence is a crucial way of not only understanding, but I believe that as you mentioned, like the language barrier. If people even understanding the culture, trying to understand and have providers or have people within the community that understand or that they're part of the community, people will feel more trust in the message that is given to them. So if you hear a positive message about mental health from someone, from a trusted community leader, then you will be able to take that opportunity and those techniques, because you feel that trust from that, from that individual. So it's crucial. People will feel more comfortable in listening, and not only in listening and taking the advice, but also promoting the services to others, to their family, because Sometimes when we give the information to a particular patient individual, you're not only giving the advice for themselves, but you do it for, as a family, as a whole family approach.
I agree. Thank you, Josefina. Thank you, Dr. Salvio. So I have another question, and it's open for any of you if you want to respond it. So the following is, what activities do you recommend for people to take care of their mental health?
Well, I know that we have heard, wonderful recommendations and advice, and but even the simplest thing, going outside, going into nature, taking just a basic walk in the morning, being around animals, being around nature, that could make a major difference. And now we know that even what is going on in the nation, we even have some medical providers prescribing nature walks, just basically go in nature for 20 minutes and you can feel the difference. And not only for medical providers, but for all of us, for, in any field that we are, we're focusing, with, working with volunteers, if we're working in the community in any type of field, healthcare, etc., just basically going back to nature and helping each other. And I agree with Dr. Sayub had mentioned about even just contacting people, calling people, not only because we might have, we might know that they're having, some issues, but also because we just want to have that social connection with, with people, the social connection of building people, building community.
Thank you, Josefina.
Yes.
So I have one last question because of the timing. So we have another one from one of our attendees that wants to know, what practical tips do you recommend for seniors just to prevent anxiety and depression?
Yeah, so I can start. I think a lot of the topics were just mentioned even right now by Josefina, and I know the presentation, Gigi, that you had a lot of the practical tips of what are the things that you can do. So exercise, for example, and really, I love the concept of just taking a basic walk, moving, being out, and really being active. The second thing, there's more and more research mounting on this, is what we eat, right? And I realize that, we all have, and I come from a very specific cultural background, we have our foods and things that we love. It isn't about replacing them. It's about, for example, how much are we eating? When are we eating? How are we incorporating physical exercise? What are some of the healthier choices that we can make? That's a big one. Another one is really finding joy. I call it finding joy. I'll share this. And finding joy means different things to different people. Write down, what are the 3 things? It's just the practical advice I've given people over the years. Write down, what are 3 things that make you the happiest? For some people, it's being their children or talking to their children. For others, it's a specific hobby. For others, it's remembering to take a little bit of a drive in a happy place because it brings back memories. Could be many different things, but write down, what are those 3 things that make you the happiest? And then make sure that you're doing those things at least once or twice a week if possible, because that goes a long way. And then obviously the last thing is really making sure that you're connecting with someone, if you need to. It's a healthcare professional or a counselor, or if you're doing all of these other things, but you're still seeing yourself not being able to come out, or you're going in the other direction, then please seek out help. So those are just some elements there. But mind, body, the connection is very powerful.
Thank you, Dr. Salvio. And I agree with you in what also Josefina mentioned in regards to going out. Walking doesn't necessarily need to be an hour of going out and walking.
That's right.
5 minutes. Just even hearing the sound of the birds, it can help. So it's always to find ways and mechanism to get out of that environment that you feel not comfortable, and just taking like me time once in a while, right? So again, thank you to our experts and panelists, of course, and attendees for joining us for today's virtual event. So again, for more information about today's webinar and our upcoming events, please visit NHCOA's website and also our social media channels. You can find us on Twitter, Facebook, and Instagram by using our handle as NHCOA. And again, a recording of this webinar will be made available on our YouTube page. And remember that it is just as important to take care of your physical health as it is of your mental health. Mental health should not be a taboo topic, and it is important to pay attention to it to achieve an optimal state of health. And remember, you're not alone, and it is okay to ask for help. So thank you, and until the next time, goodbye. Thank you to all the speakers.
Bye. Thank you.